So what are some ways that y'all have found that are helpful for reducing
Yeah,
these
so that
barriers?
that was really the topic of our last set of projects was how do we reduce barriers to self-compassion when we know that they're linked to not benefiting from treatment when I have those barriers. So we just actually completed a couple of qualitative studies. One was in people who had recovered from an eating disorder. So they had or were pretty far along in recovery. And we basically asked them, what did anybody do? They were very clear that one of, we have an experience of care survey that patients complete at the end of treatment. And we found that they were consistently saying that one of the things that helped them the most in their recovery was developing self-compassion, that it was one of the most profound parts of their treatment experience. And when we asked them, what did anybody do that helped you overcome your barriers? I could summarize that entire project with one word: validation. So we actually wrote a paper called The Power of Validation. And it's one of the most profound, simple, but complex concepts that has come up in this area. So basically, they said that there were 4 levels of validation. And when people, whether it was clinicians or family members or people in my life, offered me these levels of validation, I slowly was able to overcome barriers to self-compassion and to become more compassionate myself. So the first level was 2 things. It was basically seems so simple, and I'm sure your students who are working in therapy would know that this is critical, but basically making time and space for me. So really showing me with words and body language that you're not just asking a question so that you're ready to ask the next question, but that you're really listening to what I'm saying, and offering a compassionate response. So whatever it is that I say, if I tell you that I'm struggling with something, rather than having a neutral or possibly critical way of looking at what I'm saying, that you're seeing that whatever I'm doing, it happened for a reason, and it's my best attempt at meeting a need that I have. And so when people in their life were able to do those 2 things, make time and space for me and offer a compassionate perspective, then the impact that it had on them was trust. That was the first building block for overcoming barriers to self-compassion. I feel like I can trust this situation to really be open and talk about this. The next level had everything to do with readiness. It's basically someone who took the time to truly understand and recognize my treatment needs. So they weren't saying, okay, you have this level of severity, you need this treatment. They were actually taking more time to understand, what's my level of readiness? What would it be like for me to make changes? What's happened for me in the past when I've made changes? What are my wishes right now? So they weren't pushing me before I was ready, and they also weren't not noticing that I'm ready, and this is the time to give me some tools or some treatment options that I'm ready to benefit from. So when people took the time to understand and recognize the treatment needs, to offer a menu of options like in the stated, where we have a home for each of the different combinations, the impact was cared for. So we get trust from the first level, cared for from understanding, recognizing. And the next level after that was very often people would start to make changes, and people in their lives would say, great, they're eating more, they're not binging and purging so much. We don't need to worry about them. We don't need to, be checking in with them. But very often they would say that at that point, they were in more distress than they had ever been, because now they aren't using their eating disorder, and they felt even more vulnerable. But people were kind of saying, great, we don't need to worry about them because their behaviors are showing that they're inward. And so what they said that they really benefited from there was someone recognizing, wow, I can see how hard you're working. I'm really, noticing and impressed with the courage that you're showing right now. And I know that this must be pretty tough. Tell me about that, and giving them an opportunity to talk about the challenges that they're facing, and pointing out their strengths, saying, I've seen you use these strengths in other circumstances, and, I can see those potentially helping you right now. Basically, just noticing how tough and hard this is, and recognizing their strengths. And when people did that level of validation, that made them feel empowered. So we got trust, cared for, empowered. And then on the last level of validation, which was totally unexpected, we called it walking the runway finding. And those were words that one of the patients actually gave us. And it's basically the patient saying, don't tell me to practice self-compassion, just like you're shoving a meal plan at me, telling me I should do self-compassion. Show me what it looks like on you. Let me look at how the fabric flows as you walk down the runway when you're wearing self-compassion. Show me that sometimes you make mistakes and that you practice self-compassion to not beat up on yourself and to be understanding to yourself and make yourself feel better. So they don't want to know our whole life story, but they want to know that we're also human, that we also have challenges, and that we also use these. And when we rocked the runway, the impact that it had on them was inspiring. So this is kind of like a crib sheet of what the environmental components are that help people to overcome barriers to self-compassion when they're in an environment of validation. And this is probably the one paper that we get the most attention from. And when I talk about it with our patients, that they're saying, can you give that paper to, my parents or, my loved ones, that it's something that they really resonate with. It's important for their journey.
And so do you think that this process is somewhat sequential?
I described it in that way, and I think that, people go in and out of the different levels, but generally speaking, at the very beginning, we really need to build trust and we really need to have it cared for. And so I think those are more early on. And I think the empowering is more for once people are actively working on change. And then the inspired one actually occurs across levels. I think it's really useful for them to see that, I'm not some, person way up here telling you what to do. I can relate. We're co-humans, and everybody has challenges, and we're the same in that. I'm not kind of in a totally different, perfect life situation that is so disconnected from